Hello and welcome back to the IU Sub Internship rotation. This video, called Evidence Supporting iHuman H&P Assessment, is a supplemental video that will help you understand the available evidence behind the Sub-I course's assessment of your performance on iHuman via assessment of your written H&P. The RHYME framework was developed by Lou Pangaro and was first published as a new vocabulary or assessment framework in 1999. There had been prior studies using this framework prior to that, but this was the first publication suggesting it as a new framework. So we'll start with reliability evidence. Pangaro and Roop in 2001 published this study, Effect of Clinical Teaching on Student Performance During a Medicine Clerkship. They took 293 third-year internal medicine clerkship students that were at 5 teaching sites in 2 academic years. Each student was evaluated by an average of 10 teachers using RHYME in a grading committee format. The reliability of the RHYME clinical evaluations was measured, and the average interclass correlation was 0.83. And a reliability of greater than 0.8 is comparable to standardized multiple choice exam reliability. So this is a reliable assessment. The validity of evidence. There are 2 studies that demonstrate RHYME's validity. The first is this study by Paul Himmer from 1997 called The Effectiveness of Formal Evaluation Sessions During Clinical Clerkships in Better Identifying Students with Marginal Funds of Knowledge. In this study, they assessed 124 third-year internal medicine clerkship students. The students were evaluated by RHYME, and they were evaluated at the end of the clerkship by the NBME shelf exam. They assessed the predictive ability of RHYME to predict a poor NBME performance. 7 students were identified as marginal using the RHYME framework and also performed poorly on the NBME. This was out of 16 students that performed poorly on the NBME. Thus, RHYME was shown to have a specificity of greater than 95%, an impressive ability to predict poor NBME performance. Internship ratings as a validity outcome measure for an evaluation system to identify inadequate clerkship performance. This study by Lavin and Lou Pangaro in 1998 looked at 410 third-year IM clerkship students over 7 years. Students who failed the third-year clerkship at Dr. Pangaro's program were required to take an internal medicine sub-I. At the time, the internal medicine sub-I was not a required rotation. Students were evaluated by RHYME to determine the need for remediation, and 97 students were felt to require remediation. Of note, 6 of these 97 were determined to need this remediation due to failure on the NBME twice. They also collected non-medicine third-year GPA, so in other words, GPA on all of the non-medicine rotations. And they measured the ability to predict internship performance by survey of program directors. So they collected this information, the students became residents, and they surveyed the residents in that, they surveyed the program director of that residency program to determine performance as an intern. They received surveys back for 75 of the 97 students who failed the third-year medicine clerkship and deemed these the remediators. And they received surveys back for 268 of the 313 non-remediators who voluntarily took a sub-internship and thus performed, thus became the control group. The results are here. The sensitivity for low internship performance using the RHYME evaluation was 75% versus using the non-medicine clerkship GPA was 8%. Of note, the medicine clerkship GPA alone had a sensitivity of 21%. And the sensitivity for an unfavorable comment on the survey for program directors was 53% for the RIME evaluation and 9% for non-medicine GPA. Students who performed poorly or marginally based on the RIME evaluation had a 12.9 times higher risk of having a low internship performance based on program director surveys. Therefore, the RIME framework was proven to be valid to predict low NBME shelf exam performance, as well as predict low internship performance. But that evidence is for RIME evaluation of clinical performance and formal grade committees. So you may be asking, how can you apply this to iHuman written H&P assessment? The Pangaro group helped us out by publishing this article in 2011 about using the RIME framework to assess students based on electronic medical records. In this, they detailed how to apply the RIME clinical performance evaluation of clinical skills to EMR-specific skills. And the Pangaro group was nice enough to share their H&P rubric that they use at the Uniformed Services Medical School with our internal medicine medical education leadership, which is here. In order to use this in iHuman, we then adapted it to the available information in iHuman. But does this show validity of H&P assessment yet? No, it shows that there is a way to use RIME for H&P assessment. But we do have some evidence of the use of H&P skills to predict performance in internship. And that's in this study by Cuddy in 2016, evaluating validity evidence for the USMLE Step 2 clinical skills data gathering and data interpretation skills, our scores. Does performance predict history taking and physical examination ratings for first-year internal medicine residents? In this paper, they collected Step 2 CS integrated clinical encounter scores from the written H&P assessment. They looked at both the data gathering scores, which assess history taking and physical exam skills, as well as the data interpretation scores, which assess the ability to compile patient notes based on ability to gather pertinent data. They analyzed these USMLE Step 2 CS scores and the ability of those scores to predict intern performance. They took 6,306 trainees that were taking the USMLE Step 2 CS in 2005, who also went on to 238 internal medicine residency programs and had available performance ratings from those residency programs. Data interpretation scores were positively correlated, and significantly so, with both history taking and physical exam ratings in IM residency program internship performance evaluations. So to pull all this together, the RIME framework is a reliable assessment framework. The RIME framework is valid to predict poor NBME performance and poor internship performance. Assessment of written H&Ps can be completed using a RIME-based rubric. And written H&P-based data interpretation ability is predictive of internship performance on history taking and the physical exam. Using this evidence, we have implemented iHuman with the assessment being of your written H&P. So this concludes the supplemental video on the evidence of using the iHuman rubric to assess your H&P. Again, I hope you enjoy the rotation, and I hope you learn a lot from your use of iHuman. Thank you.